All right, hello everybody. I'm Justin Scrow, and today we're going to be talking about the hidden cost of gender transitioning in America, advocating for trans rights without exploitation. Why this topic matters. In America, transitioning can be a life-saving process for trans individuals. But at what cost? And who truly benefits? The fight for trans rights is often framed as a simple issue of access, ensuring that trans individuals can transition safely and without discrimination. But beneath this surface, there is another reality that is not discussed enough: the fact that the American healthcare system, driven by profit, has turned this deeply personal process into an expensive and often exploitative industry. According to the UCSF Transgender Care Center, the costs of hormone therapy, psychological evaluations, surgeries, and legal changes add up to tens of thousands of dollars, leaving many trans people without options. Insurance policies are inconsistent, and corporate interests, whether in pharmaceuticals or media, often exploit trans identity for profit rather than actually working to improve access to care. NPR journalist Farah Shaban highlights how pharmaceutical companies see the growing trans demographic as a business opportunity rather than a community in need. This isn't just about trans rights. It's about ensuring that trans individuals are not financially exploited under the guise of medical necessity. If we are truly advocating for trans equality, we have to ask, are we building a system that genuinely supports them, or are we allowing a system that just sees them as another profitable demographic? The financial burden of transition. Let's start with the cost. Transitioning medically in the United States is incredibly expensive. According to GoodRx Health, hormone therapy alone can cost between $1,500 and $2,500 a year, depending on the type of treatment and whether insurance covers it. If someone seeks gender-affirming surgeries, those costs skyrocket. The American Society of Plastic Surgeons reports that top surgery can cost anywhere from $10,000 to $15,000, while bottomic surgery can exceed $50,000. These numbers don't include additional expenses like legal name changes, gender marker changes in IDs, or therapy sessions, which are often required before medical transition can even begin. The National Center for Transgender Equality highlights that many states require psychological evaluations before trans individuals can legally change their documents or access medical procedures. Despite the clear medical necessity of transition-related care, Kaiser Family Foundation finds that many private insurance companies still categorize gender-affirming care procedures as elective, meaning they refuse to cover them. Meanwhile, the Movement Advance Project reports that access to transition-related care through Medicaid varies drastically by state, meaning that depending on where trans persons live, they either may have full health care support or be completely shut out of care. For many, this financial burden is devastating. According to GoFundMe's internal data, thousands of trans individuals rely on crowdfunding just to be able to afford basic medical care. When people have to beg for health care, that's not accessibility, that's exploitation. The ethical concerns of profit-driven transition. And here's where the deeper issue lies. When something becomes expensive in America, that usually means someone is making money off of it. Pharmaceutical companies, for instance, have a vested interest in gender-affirming care. The Health Affairs Journal reports that the cost of hormones, despite being relatively cheap to manufacture, has only steadily increased as demand has grown. Rather than making these medications more accessible, companies are capitalizing on the necessity of treatment. The medical field itself has ethical dilemmas as well. According to the World Professional Association for Transgender Health, gender-affirming care follows two primary models. Model 1 is gatekeeping. Some clinics require extensive psychological evaluations before providing hormones, making access difficult. The second model is informed consent. Other clinics allow immediate access with little oversight. Both approaches come with risks. Excessive gatekeeping leaves trans individuals stuck in limbo, unable to access the care they need. But on the other hand, immediate access without long-term psychological support can lead to individuals undergoing medical procedures they may later regret. While detransitioning is rare, a study published in the Archives of Sexual Behavior found that those who do detransition often cite a lack of psychological evaluation as a key factor in their experience. Maybe because they couldn't afford it, didn't have healthcare access to it. We need to strike a balance, ensuring trans people can transition without unnecessary barriers while also making sure they receive the medical and psychological support they deserve. advocating for trans rights without exploitation. So how do we fix this? How do we create a system that truly supports trans individuals rather than treating them as consumers? First, and most difficult for everything, is we need healthcare reform in the United States. The Kaiser Family Foundation emphasizes that gender-affirming care should be covered by all insurance providers without loopholes that exclude those who need it most. No more forcing people to crowdfund for their survival. Additionally, the Health Affairs Journal argues that protections against pharmaceutical price gouging are essential to ensure that access to hormones isn't just a privilege for those who can afford it. America. Second, we need ethical medical practices. The WPATH standards of care stress the importance of balancing accessibility with support. Trans individuals should be able to access gender-affirming care without excessive gatekeeping, but they should also have access to long-term psychological support, not as a barrier, but as a resource. Additionally, a study in the PLOS highlights the need for further research into transition outcomes to ensure that policies are based on actual data rather than economic pressure. Finally, we must stop the commercialization of identity. Every June, corporations slap a rainbow on their products and claim to support trans rights. But according to Forbes, many of these same companies fail to advocate for real legislative changes that will improve trans lives. Real advocacy means for pushing for healthcare reforms, employment protections, and housing rights, not just making colorful marketing campaigns. Trans rights go beyond medical transition. True equality means protecting trans people in the workplace, ensuring they have access to housing, and providing mental health support. The Human Rights Campaign emphasizes that trans people face higher rates of unemployment, homelessness, and mental health challenges, all which must be addressed if we truly care about trans rights. Where to learn more? If you're interested, you can go to the Human Rights Campaign. That's www.hrc.org. This provides legal and healthcare protections for trans individuals and information on that. Another great resource is Planned Parenthood, www.plannedparenthood.org. They offer gender-affirming care services, including hormone therapy. And from the research I did, Planned Parenthood seems to be the most affordable and accessible program for trans individuals. The Movement Advancement Project, or MAP, that is on www.lgbtmap.org. This tracks state-by-state policies on trans healthcare and where it is most expensive, where it is more affordable, where states obviously care more or care less, unfortunately. And the last one I have here is the World Professional Association for Transgender Health, that's WPATH. And they are the governing body that establishes medical guidelines for ethical gender-affirming care. That's another really good one to look at. So in conclusion, trans rights should never be up for debate. But if we want to truly support trans individuals, we must also be critical of the systems that profit from their struggles. I don't mean to editorialize myself here, but that's America again. The healthcare industry should serve people, not exploit them. A just system would ensure access to gender-affirming care while protecting individuals from financial ruin. True equality isn't about being allowed to transition. It's about the right to do so without being exploited. And if we want to be real advocates, we need to fight for a system that supports trans individuals of every aspect of their lives, not just in the ways that are profitable. Because trans lives are not a business model. They're people, and they deserve better. That was my prepared presentation that I wrote, but I want to add knowing and being friends with a few trans individuals and seeing, taking everything out that society judges them on or demonizes them or puts them down, taking that all separately and watching financial ruin happen because somebody is just trying to be their self. It really bothered me to my core. I have a young friend that I know through my volunteer work that their parents worked 3 jobs each to support them and fell into complete financial ruin. And I know that they were happy to do it for their child, but they're in financial ruin, and they're at a place now where if they had proper access to health care, they wouldn't have lost their house, and that really led me to this, and I was guided by the individuals I know of this being a huge concern of, I didn't really contextualize it myself because I think of this movement gaining strength in Europe and in the UK and forgetting they have nationalized health care. People in the United States do not. And we live in a profit-driven insurance world where medical care and insurance, they're all just jacking up prices to exploit people. And even with insurance and even having some coverage, it still wasn't enough. So that's my little separate editorial there. I hope everybody got something from this. I've got lots of websites if anybody's interested. All right, take care, everybody.